in today's episode, we're going to be talking about the real reason you feel lost in CT and how to fix that. I get lots of DMs, lots of questions on technologists that are lost in CT. They're starting out, they've been in the modality 10 months, 6 months, 18 months, whatever the case is, and they just feel like they're fucking lost and they have no guidance and have nowhere to turn. So I decided to make this episode to kind of give you some really good pointers and some really good just tips so that you can take this away and put it and implement it into your CT training. Hello. Welcome back, everyone. Welcome back to the podcast. Hope everybody's having an amazing week. Let me tell you, we just got like 2 days of freaking just inches and inches of snow here in Illinois, especially the Chicagoland area. So, because I live outside of the city of Chicago, so it has been interesting. Plus, my girls had to have a snow day, and that just was not a lot of fun because it kind of throws off my routine and just, my day-to-day things that I have to do when they're at school. So, but of course, we have to adjust accordingly, right? As parents, or just as individuals, you have to adjust accordingly. So quick updates. So make sure you guys check out all the courses, free checklist that I have. I have all my courses in school. So that is the platform that I'm using. I know I have used Udemy. I am in the process of moving my Udemy students into my school portal because I want to be able to house all the courses and all the lessons that I provide. So make sure you guys check those out. Plus, I have an awesome 10-episode audio series, and I'm going to be dropping some more stuff in my school portal. So make sure you guys come in, join that community, and get in all those courses, especially if you need some guidance when it comes to your CT training. Also, make sure you guys subscribe to the YouTube channel. I'm in the process of putting some more stuff on YouTube. I know it's been a challenge. And the thing is that I've come off of a stretch of 512s and the holidays are coming up. So my schedule is going to be a little bit modified. So I'm going to try to get some more educational stuff on my YouTube channel because I know it has come from multiple requests and it has been asked and I am going to deliver. Also, make sure you guys follow on TikTok at the CAT Scan Guru. I post all my protocol videos. All those protocol videos are going to be on a playlist on my YouTube channel. So I'm gathering all those together to make sure that I provide that for you on the YouTube channel so you guys can binge that and watch that. So it's all in order. Okay. Also, I'm working on something that is really big for CT technologists. Now, I said this in my previous episode. I can't reveal what it is just yet because it's still in the works and there's some, things and legalities and things like that are going through this. So kind of have to keep it a secret for right now, but I will probably give you a little preview, but you have to follow me on TikTok to get that preview, okay? I'll probably put it on YouTube as well. So make sure you guys follow along for that. And then as soon as I have that ready to go, I will drop it here. I will drop it on TikTok and I will drop it on my YouTube channel, okay? So make sure you guys check that out. So let's get into today's episode. So in today's episode, we're going to be talking about the real reason you feel lost in CT and how to fix that. I get lots of DMs, lots of questions on technologists that are lost in CT. They're starting out, they've been in the modality 10 months, 6 months, 18 months, whatever the case is. And they just feel like they're fucking lost and they have no guidance and have nowhere to turn. So I decided to make this episode to kind of give you some really good pointers and some really good just tips so that you can take this away and put it and implement it into your CT training. So how do we get to this problem? So what I see is a lot of technologists walk in and they're hoping to just perfect every exam. Okay, let's take a step back. Every exam is not going to be perfect because every patient isn't a walkie-talkie textbook ideal patient. Where I work, we get some of the sickest patients that you will see. And sometimes you get patients who are contracted, patients who, have fractures. They have all different kinds of things going on with them. And a lot of times they're just not ideal. So you have to know how to work around that and know how to navigate all that. So I'm going to be giving you some tips on this. So you can't walk into the department thinking that you're going to hit every exam perfectly because things can happen. Poor cardiac output, IV issues, contrast enhancement wasn't that great. the IV infiltrated, the images are really grainy, the patient moved, there's all kinds of factors. So what we want to focus on is making sure there's repetition and there is consistency and making sure that you practice. Those are the most important things that you have to worry about. Okay. Now let's get to the root of that. What is the main cause of that? Well, I can tell you there's a few things, and I know it's going to trigger the fuck out of some of you guys. Zero guidance. And I say this in a lot of podcast episodes is that when it comes to guidance, what I mean is that there's a lot of techs out there that are becoming button pushers, and they're getting trained by experienced techs that they're saying, push this, but no, we have to stop that practice and stop adopting that, because we have to stop that, because you're going to potentially put them in a very dangerous situation. So the root cause some of the time is zero guidance. Okay. Then the second part is minimal onboarding. So what I mean by onboarding is when you're starting, it's not really getting a clear picture or like a checklist or something structured to say, okay, this is what's happening, right? This is what's taking place. This is what we're going to learn this week. That's why I've provided a free 8-week checklist, something that I put together that I feel that's how you should learn. It may not be adopted by everybody, or it may not work for some people, but at least it's a guide to let you know, okay, this is how you should learn in your CT training. So that's a lot of the things that I've seen over the years, where there is just very little onboarding and very little structure when it comes to training. Like, there's no training programs in departments anymore, because I know that used to be a thing. And I know where the facility I work at, we do put new techs through a training program and making sure that they understand how to navigate exams and operate on their own. So that's kind of the things that I see are the root cause of why people may think that, I feel lost, and this is why. We have to give our techs more guidance. We have to make our onboarding process a lot stronger. We have to make sure that we create those structured training programs, whether it's 8 weeks, 12 weeks, 6 weeks. I personally think 8 to 12 weeks is enough, especially for a newbie and a new beginner. When it comes to travelers, I know that usually they give them like 2-3 weeks training. You should also have something separate set up for them, because that helps them, because this is a new facility. New policies and procedures, new protocols if your site is different. So we have to be able to guide them with that. Now, how do we fix this? So my strongest recommendation is when we're training out there, have the new tech, or you, the new tech that's listening, focus on 1 to 2 core exams. Let's say, for example, a week. So if you're going to focus on head CTs, focus on that. You're going to focus on PEs, focus on that, because that's super important. And I know that sometimes, especially when you work like in a level 1 trauma hospital like I do, it's hard to do that because you want to learn all the exams. But what I would say is just narrowly focus on those exams so that you can get the repetition, get the experience, and know how to set them up properly. It's not about perfection. It's about making sure that you execute the exam properly, center properly, and get an optimal exam. So that is one way to fix it. And another way we can fix it is to have like a structured training program. Whatever it is, it's very beneficial and it's very helpful. Another way is to stop with telling technologists to push certain buttons. They have to know the why they're going to do the exposure. They have to know exactly why they're administering contrast at this time, or why they're initiating the scan and the injector at the same time. We have to have proper guidance with that. And that is one thing that I think it's really missing when it comes to training new technologists. And we really, as a whole, need to do a better job of that. Okay. The next thing I'm going to ask is that you pair your training with some kind of structured program that's created at your site, if it exists, or you can download my free checklist and that'll kind of guide you on what you should be learning. You should be pairing those things together. And then along with, if you want to do like a cross-sectional anatomy book, you can do that. Make sure you take notes. I stress in every podcast episode, please take notes. Notes are very important. I could tell you that I have a crap ton of notebooks with all kinds of CT notes from every site that I've ever worked at. And sometimes I have to refer back to that. And sometimes I still write notes to this day because sometimes I have to remember things. Your brain cannot remember everything. So I highly, highly encourage it. Okay. Please stop waiting for perfect training. You're never going to be perfect at training. We all make mistakes. We're human, and it's how you correct them so you don't do it again the next time. Make sure you build your own system, because I can tell you, I work in a department where there's 25 to 30 techs. There's a lot of us, okay? We have our own system on how we set up the exam, how we execute the exam. But you know what? It doesn't matter how I set up my exam versus the next person. They set it up differently. As long as we get the same optimal exam and the same result, that's all that matters. So make sure you build your own system, build your own flow, build your own speed. I don't expect a new tech to go ahead and go at the speed that I do. I want you to go at your own speed until you're comfortable and that you just adopt your own practice. So with that, make sure you guys grab my free checklist. That is just a guide to help you. So it may be helpful for some and it may be repetition to others. And if you want to go a step further, I have a 10-part audio series that walks you through the concepts that I feel that you need to know. Everything will be in the show notes as far as that. So that is our episode for today. So I hope this was insightful. Make sure you share it with a technologist that needs to hear it and they don't feel lost in their CT training. Okay. So thank you so much for joining me on this podcast episode, and I will chat with you guys next week.